Hello everyone. So today we're doing a lower blepharoplasty on this lovely patient of mine, and we're doing also a direct brow lift. As you can see, we marked up here how much skin we need to remove. Direct brow lift just involves removing excess skin above the brow. It's good for patients who really have a lot of skin here, and then it kind of helps us to kind of lift the brow and put it in the better position without complicating too much of the dissection and other things. And it's a much simpler operation. It can be done in the local anesthetic on its own, so it's usually fairly straightforward. Lower blepharoplasty, however, it needs to be done under some form of general anesthetic. So this patient has a lot of excess skin in the lower eyelid, which we're going to trim, but also we're going to have a look under the eyelids themselves to see what the fat pads are doing, because sometimes you have extra fat bulging through, and especially in hair, if you can see this area here and there. So we might trim that a little bit and just refine the shape of that, and then we'll show you the rest in a minute. Right, so we've just made an incision in the lower eyelid now. As you can see here, we're just kind of lifting the skin and the muscle, and we're just gonna create a little flap. We call it a musculocutaneous flap, which will allow us to go into the septum where the fat normally is. And then we just use a diathermy, which is a device, which will hopefully give us a plane to go through. So this just cuts through the muscle now, and as we are going through that, it will go through the muscle, and that means then we can have a nice pocket to go underneath to lift everything to get down to the layer that we want, which is where the fat compartment is. And this is now, I'm just lifting the orbicularis muscle off the septum, and we're doing it slowly to make sure we get enough closure but not too wide straight away, because I need to assess the septum in the first place. So I need to go down all the way down to the infraorbital rim, which is the bony bit of the... Okay, so we've just now exposed, this is the muscle here, and this is the fat that is inside the eye socket, which is where we're gonna sort of manipulate and try and use for our advantage to kind of give a little bit more fullness in here. And this is the orbital rim here. This is the bony bit that I can feel. You cannot see it as such, but I can feel it with my tip. So what I'm trying to decide here, whether I need to trim fat only, or do I need to use that to kind of fill that gap here so she has a better fullness under the eye in the tear trough area, because she's got some hollowness there but not significant. And this will be decided once we've decided to do what to do with the skin and the fat underneath, and that's it. We've just now used some of the fat that is inside the eye globe, just behind the septum, and we've just taken out, trimmed a little bit, and we just used it just to fill up the gap here under the muscle, which will help just to give it a bit more volume. We've trimmed a little bit, as you can see here. There's just a small amount of fat from the middle part, and this is from the other outside, which is this bit here, and I think that would be enough for her to give her some volume, but the main thing is to trim the skin. So we're trying to do now the canthopexy, which is an essential part of the lower blepharoplasty, and this is just to tighten the lower eyelid and to support it. It's like a washing line through the lower eyelid to make sure when things are healing are not pulling down against it. And obviously there's laxity here with age, and with the surgery itself we are disrupting all the mechanics of the lower eyelid, so it's important to restore that. So the idea is of putting this suture is to make sure that we anchor it to the bone and the inside of the rim of the bone. So I'm trying to catch a good bite in the actual bone itself to make sure that we have a good anchorage. And this is like pretty strong. So the idea is, you know, that we've got a good bite is when you can actually lift the patient's head with it, and it's very strong. And then we'll pass it through the muscle on the outside, and the idea is that then that will help us to get tension onto the lateral tarsus strip, and making sure it's not inside. So a good bite in that and the muscle, and then we'll go back onto ourselves to ensure that this is nice and snug, and then we'll just go back and that please. So now we are just marking how much skin we need to remove. This is the final step, and essentially we want to be conservative as much as possible and then trim as we go. So I'm just outlining how much I think I need to remove, and almost always I go a little bit less just in case, but it's a good practice to do less to ensure that we don't take too much.